was such a last minute. Already had turned into.
All right, I got it. Yeah, I got it. Yeah.
Let's see which one of these judges raises this check.
Is that it right here? It's like a little question.
Which one raises the check?
I can't never raise them. Doctor, can you
Oh,
help
yeah.
her with her chair?
Chris, I'm at a 2-day medical board
I think that did.
hearing.
Let me see.
Thank you. Pulls out.
So the additions are, and I only have the one copy. That's on the full board meeting.
Okay.
And on the investigative subpoena tab, they have it. So that's number 9.
Okay.
So we have 1, 2, 3.
All right. Very good.
And I'm just gonna go with this and go get another copy. This is what Dr. Wells.
Thank you. Under there.
Over the Zoom.
Okay. We got her in there yet?
That's not an invitation.
What meeting is that?
So she's not going to be zoomed in?
I'm trying to give them.
Okay. Why don't we just get started with Dr. Kennard? So, because we have a full board meeting coming up.
Here, we got her.
I am gonna have.
We got her.
Dr. Owens, are you there?
Yes, I'm here.
Very good. Okay. We're going to begin the executive committee now, March 24th, 2021. I'm going to let you introduce yourself.
Alexis Morris with the Attorney General's office.
Okay. Dr. Ann Ray, President. Dr. David McClendon, Vice President. Dr. Michelle Owens, Secretary of the Board.
Oh, she's here. Okay.
And this is about a personal appearance of Stephen Lloyd, MD, an applicant who has not completed expected exam or medical proficiency exam within the last 10 years and is requesting a waiver of licensure requirements. Is that correct? Dr.
Yes,
Lloyd?
ma'am. I'm sorry. I'm sorry. I didn't know if could be heard. Yes, ma'am. That's correct.
Okay, that's not coming through at all.
Dr. Lloyd, we could hear you more clearly earlier. Did you change your position in the room or your microphone or anything?
Ma'am, can you hear me?
That's better.
I didn't. I've been so nervous. I haven't. I barely taken a breath. So no. Can you hear me now?
Yes. Okay, Dr. Lloyd, I'm going to let you explain to us why we need to waive the requirement for the specs exam.
I'm sorry, I wasn't able to hear you guys, but I can now. And I think Dr. Owen said she could hear me. Is that correct?
Right.
Okay, and I'm sorry, I didn't hear you at all. I just figured out where the mute button was for you guys and I undid it.
Okay. Okay. Looking at your waiver request, and I would like for you to explain why we should waive the specs exam requirement for you.
Absolutely. I've been in continuous practice 2001 when I was licensed in Tennessee. The only reason I need a Mississippi medical license is to work with the Mississippi Medicaid program in helping people with opioid use disorder. And so I am an internal medicine physician by training. I was board certified in 2015. I started to work in the addiction medicine field. And when I was going to get changed the exam, didn't give it that year. And my internal medicine boards expired. I didn't retake them because I was practicing addiction medicine at the time and still am. And then I went to work for the state of Tennessee under Governor Bill Haslam as the for substance abuse services for the state. I've been continually involved in the field, and to meet Mississippi's requirements, I'd have to go back and have to, first of all, take my internal medicine boards and then take the addiction medicine boards. And frankly, with the thing that, so I was requesting a waiver based on never had a license, never had an issue with my medical license. I sit on the Tennessee board. I'm actually the vice president.
We're going to see if we can get you on the phone.
I've never had a gap in my clinical care. Matter of fact,
We're going to see if we can get you on the telephone.
Okay, I would love that.
Yeah, you're coming through horrible. Whose phone we're gonna use?
Do I need to do something?
You just confused.
Yeah.
I'm just certified assistant to fill out his medical board. I can three-way call him in if you want to hang tight.
Yes, because this is the number that I received from him to call just in case we had technical problems.
Yes. This exact number?
Yes, this was the number I had.
Okay. I know, I think if he calls this exact number, he can call me on when he can reach out to you guys.
Yes, yes. 502-4819. Or you can give me his number and I can call him right now.
Yes, let's do that. It's, hold on, I actually have to look it up. Okay, it's our number 6.5 318 4992.
Thank you. Oh, here we go. Dr. Lloyd.
Hello.
Dr. Lloyd.
Yes, ma'am. I'm so sorry. I'm in rural East Tennessee and internet connectivity is horrible and I'm so
Yes,
sorry.
he is.
Okay.
Okay, can you hear us now?
I can. Thank you so much for doing this. I know it's an inconvenience. I appreciate it.
Let's see if we can hear it better if we put him by the microphone.
Okay.
Dr. Lloyd, give us a test again, please.
Yes.
That's on it. Okay.
Okay,
All right, let's go.
let's start again.
Okay, sure.
What are you planning on doing in Mississippi?
I'm planning on working with the Mississippi Medicaid program and helping with getting folks with Mississippi Medicaid access to treatment for opioid use disorder. I know it's kind of a weird history, but even though I'm a trained internist and taught in medical schools and done all that, I've practiced addiction medicine now full time since I came to Nashville and took over and as the assistant commissioner for mental health and substance abuse services. When Governor Haslam was unlimited and left the job, and Governor Lee took over, I went back out into practice and have gotten involved with treatment facilities that provide medication-assisted treatment to patients with opioid use disorder. So I am a provider and actually do the training for our Medicaid program here in Tennessee, TennCare. And our practices have been contacted by the state of Mississippi's Medicaid program in order to help them as they go about setting up access to medication-assisted treatment for opioid use disorder in the state of Mississippi.
Okay, now what does that entail? Will you be looking at patients directly or do administrative work? What is that?
It's actually hopefully both. I mean, I always hate the strict administrator role. I always want to have the opportunity for patient care. But right now, it's basically in a consultation mode with Mississippi's Medicaid program. I'm not sure, the landscape in Mississippi, I'm not entirely sure of around medication-assisted treatment. I know what it is in Tennessee. And so it has been that way in a lot of states that I've gotten involved with. So when MAT came about, it basically in a lot of states looked just like the pill mill did several years ago with pain medication. So you had patients coming in, the doctor writes a prescription, they go out the door, and then you have problems with diversion and all the stuff that we know comes along with that. Using medication needs to be part of a comprehensive treatment program that not only helps with the medical end of it, but also has case management services as well as the wraparound services for social determinants of health. And needs to be heavy on the counseling portion to help people get into long-term recovery from substance use disorder.
Okay,
So,
I'm going to interrupt you there, if that's okay.
That's what we did. I'm sorry.
Let's focus on the licensure requirements and what you need to do. And
Right.
as opposed to opioid addiction therapy. Have you taken a specs exam?
No, ma'am, I haven't taken an exam since 2005
Okay.
When I got board certified in internal medicine.
Okay. Dr. Lloyd, I was on this board when I applied for a license in the state of Alabama, and they didn't cut me any slack for being a board member. And I had to go
Right.
take the
I'm not
specs exam.
I'm not asking you to come in.
Okay, but the specs exam, I had to take it. And get over with it and just do it. Is there some reason you can't take the specs exam?
Okay. With all due respect, I wasn't asking for any special treatment. I wanted to explain what my role was. And
Okay,
I'm
well,
not
sir,
going to take the specs.
sir.
Yes, ma'am. Yes, ma'am.
Let's talk about licensure in this state and the requirements in this state and what it takes to get a license here. And you haven't had any board exams in over 10 years, and this state requires a specs exam, and we're not the only state that does. I know Tennessee does not. So is there some impediment to you getting the specs exam other than just time?
Can you tell me what the specs exam is?
This is a test that's formulated by the Federation of State Medical Boards. It's It's an 8-hour exam done in a testing facility that is general medicine knowledge. I'm an anesthesiologist and I had to take it. It's probably more pertinent to what you do than to what I do.
No, ma'am, it's my whole issue is time. And, you know, if that's the case, then I'd just like to withdraw my application for licensure.
He can withdraw if he wants to.
Now, he can withdraw if he wants to.
Yeah.
If that's what you want to do,
Yes, ma'am, it is. The things that I'm involved in, it's absolutely time conclusive, and I appreciate your time today. I'm sorry for wasting your time, but that's the stuff that I don't have time for right now. And so
well, it can be done within a month, probably.
I'm sorry?
It probably can be done within a month. It just has to be scheduled. And you, and takes a day.
I don't mean to talk over you at all. There's a delay, and I feel like I'm being I feel like I'm interrupting, and I don't want to do that. And I know it just takes a day, but you know, that's just something I don't have time for. It's why I was asking for the waiver, and if there wasn't a possibility for that, then I'll just withdraw my application, and we'll focus our efforts in other places. And that's fine with me. And I completely understand and respect the decision of the board.
Dr. McClendon, any questions, or do you concur? Or?
I agree with what's happened. If he's not going to take the specs exam, these are our rules.
Well, if you change your mind and take the exam, we'll be looking forward to seeing you later.
You bet. Thanks so much for your time.
Yes, sir. Thank you. Okay. Yeah, they didn't, I was a board member then, they didn't cut me any slack for being a board member.
So, yeah, it bothers
That's
me
just
that he didn't even know what the spec, he put all the effort to come to us being a board member of another state and didn't even know what the spec exam was. Yeah.
By definition, he's a member of the federation, just like we are. Okay. All right, let's go down to item number 2, which is appearance of Randy Lynn Wagner, PA. Ms. Wagner, are you there?
Yes, ma'am.
Okay, I'm Dr. Ray. I'm the president of the board. Dr. McClendon's vice president. Dr. Owens is online with us by Zoom. This is proposed protocol submitted for consideration and approval. And what are we planning here? Would you tell us what your plans are, your protocol?
I believe the protocol was submitted last month, but real briefly, I'm part of Voya Health, which is a telemedicine organization who would like to practice in the state of Mississippi. And we are focusing currently on musculoskeletal.
Do you practice in this state at all?
I just got licensed, and I'm waiting on approval of my collaboration agreement before I can actually start seeing patients.
Okay, where are our PA regs?
Ms. Wagner, can you give us a little bit more detail about where your collaborating physicians are, where you are, and how you see the protocol working?
Of course. I'm located in Tennessee, and Voya is currently looking to see patients in the state of Tennessee and Mississippi. We are partnering with Dr. Midius, who I believe the board is familiar with. And his patients would be referred to Voya Health. They're non-operative patients, and then we would take care of them via telemedicine, via a integrated care model with health coaches and physical therapists, and of course, the clinical team. So my role with other nurse practitioners is to see these patients as part of the integrated care team. We work directly with who would be my collaborating physician, Dr. Woznicka. And anything else that you'd like to know?
Where are they located?
Where is who located?
Dr. Medius and Dr. Wisnicki.
Dr. Midius is in Mississippi, and Dr. Woznicka is living in Florida, although he is licensed in the state of Mississippi.
Backup is in Mississippi.
And she's in Tennessee.
I'm a little bit confused. May I ask a question, please?
Certainly.
The application mentions, I think it's Dr., how you pronounce his name, Woznicka? At one point, it looked like he was in Pennsylvania, then Illinois, now it's Florida. Where is his practice primary location?
Ms. Wagner, where is the primary practice location of Dr. Woznicka?
He's actually on the call. Is it all right if he speaks for himself?
Sure.
Dr. Woznicka, the application that was submitted initially showed your primary location as the collaborating physician to be in Madison, Mississippi, and we found out that that's a corporate office. Is that correct?
We can't hear him.
Dave, you're on mute.
Thank you. Good morning, all. Yes, the question regarding the location of the office, that is the corporate office. As regarding my location, I do live in Florida. I have trained in Pennsylvania as well as Illinois, most recently living in Illinois. So I believe some of what you're seeing in the history is actual just moving for educational purposes and fellowship training.
So you don't practice in Mississippi at all?
I do not. I am licensed to practice medical care in Mississippi, but at this time we provide supportive services to established practitioners in the state.
Okay, so neither one of you is in the state. And what's your background? What's your specialty?
Of course. I am board certified in physical medicine and rehabilitation, as well as board certified in sports medicine. So I specialize in non-operative care of spine and joint pain.
Okay.
You being in Tennessee, I'm talking to the applicant now, I apologize.
Oh.
You're in Tennessee, so your patient contact in Mississippi will be basically telemedicine only, is that correct?
Yes, sir.
What technology are you going to be using?
I'm sorry, could you repeat that, please?
What's the technology? Is it going to be audio, video, and what? Playback? Live?
It's all live audio, video.
Okay. What would be the nature of the care that you'll be provided through live audio, video?
Sure. So our patients are first seen by the health coach who asks questions regarding the patient's pain and what they've got going on, create some wellness goals with them. And then that health coach passes the information along to us. Our first integrated visit with the patient is 90 minutes long. They pass the information on to the provider, PA, NP, MD, and we continue on with red flag screening and then go ahead and clarify any clinical concerns and perform a physical exam diagnosis, and then we pass along on to the physical therapist if that patient is cleared for that type of treatment.
How do you do a physical examination by telemedicine for a patient with a suspected ACL tear?
If
So
I may speak, if I may speak to that point, at present, our primary goal is for neck and spine care. So a lot of the physical examination maneuvers will not require a practitioner applying force to a joint, such as a knee. However, that being said, with physical examination, a lot can be done without actually being there. An ACL, granted, would need multiple maneuvers, and we do have established protocols for referring to on-the-ground practitioners. Additionally, when we are working with a partner site, such as Dr. Midias, we are typically being referred a patient by them. So there is access to medical records and physical examination of those medical records, which are reviewed prior to discussing and meeting with the patient virtually. However, we have used a team of validated measures published in the Mayo Clinic proceedings for virtual musculoskeletal telemedicine, and we have devised our own as well, working with an interdisciplinary team of physicians and physical therapists that have many years of experience in this field.
Okay, I'm looking at our regulations, and I see that primarily the physician who is supervising the PA is required to practice medicine within the state of Mississippi for a minimum of 20 hours per week or 80 hours per month. That lets you out.
If I may, Dr. Ray, that regulation has not been completely finalized yet.
Okay.
It's with the OLRC.
Okay.
Currently. So that will be the regulation. In discussing this with Ms. Wagner, I brought that up, that will be an eventuality. And after some time to reflect and think on it, they decided to go ahead with this application.
Okay. So. And the other point of this part of this piece is to telemedicine practice in this state is done with somebody who has already established a face-to-face relationship with the patient. Is that correct?
It sounds to me that's what they're proposing. That Dr. Medias would have his cohort of patients, and he would refer certain ones he felt was appropriate to this group. Is that correct, Dr. Wisnicka?
That is correct.
So they're proposing, it sounds like, to be some sort of adjunct to him in what it is that he does on a day-to-day basis to cover more, I guess, rudimentary, follow-up type care.
Collaborating physician is the way that they're going to get referrals.
Right. The backup. In the information they provided, the backup is Dr.
Well, by definition of our rules and regs, he would have to be her primary collaborator and not a backup, but the primary, and she would still have to have a backup who practices in the state.
Excuse me, ma'am, this is counsel for Voya Health. Currently, those requirements are not in place, and Voya Health complies with current Mississippi regulations. I have to emphasize that in treating these patients in the state of Mississippi, the Voya Health clinicians will have access to the medical records of the referring local Mississippi physician. In this instance, Dr. Matias's, who will have physical examination. The clinicians will have access to those physical exams and medical records, And to the extent follow-up care is necessary in person, they will be referred back to the local practice.
She can still not have a supervisor who is out of state and does not practice within the state 20 hours a week.
But that, with Dr. Ray, that hasn't been passed by
Right, that hadn't been
OLRC yet.
passed, but we relaxed these regulations compared to our old ones, didn't we? Where the PA had to be in the office with the physician.
Well,
25 miles.
Guys, this is Michelle Owens. The other thing, and I appreciate the gentle reminder by the attorney, but the other part is I have serious concerns about a referral pattern based on and treatment plans being devised based on third person impressions of prior exams that are done that don't take into consideration things that could change in the interim, and not having a person who actually has the opportunity to perform a physical exam should one be indicated. And I have not yet heard how you would just keep from sending the person back to the same provider in order to resolve any of those issues when they arise.
If I may speak to that, as I said, most of our physical exam can be done virtually and very effectively with that. So we're not really losing moments in time if what you're thinking of is the patient's examination with, say, one of Dr. Midias's partners, or Dr. Midias himself, is now changing for evaluation by us. So typically in our experience, that does not usually happen. And furthermore, we go further along in the evaluation as opposed to a typical visit with a medical practitioner. Not only after seeing myself or Randy, they would then go to a physical therapist, and that physical therapist is trained to deliver virtual physical therapy care. So I think what Randy did mention with the red flag screening is the most important part, arguably, of what we do. We always make sure that the patients are set up and safe to have telemedicine treatment and evaluation. If we do not feel that they are safe for this, then of course a referral pattern would be established backwards or to an emergency department locally in those kind of cases. However, we do feel very confident in the services that we can provide and the evaluation that we can provide, even though it is virtual.
I'm a little bit confused. You've got a physical medicine physician in Mississippi who actually sees the patient first time, and why do they need you at all?
Actually, he is an orthopedic surgeon.
Right.
So typically, the physical medicine field, we do more non-operative care. So we want to and we do pre-operative care for optimizing surgical outcomes and such. But they would not be seeing a physical medicine rehabilitation practitioner who's then referring them to ourselves. If that answers your question.
I think the point Dr. Ray's trying to make is you're taking a patient that has been physically seen by a board certified orthopedic surgeon and referring them to a PA that's doing telemedicine from Tennessee. It makes no common sense.
No, it doesn't. That just sounds like a business model. And we're here to see about making sure we have that we are caring for Mississippi citizens, and we know there's accountability to all people who give medical care of any variety to Mississippians. And most orthopedic surgeons already have physical therapists and whatever too. So I'm not sure what this model is, but
the situation would be different if the PA had a full Mississippi license and collaborated with Albany Orthopedic, and then was using a third-party company to provide maybe some extra services that still also had a presence. But this is just all convoluted.
Yes.
Is there a gap like that exists? I mean, is this born out of an issue with current access that does not exist for these patients?
Well, everything is born out of necessity, and I think that there is a demand for this in the fact that patients typically may have difficulty obtaining physical therapy referrals, the time to go to a physician and then followed by a physical therapist, and of course with the pandemic, et cetera, having issues or discomfort with actually seeing people in person. So I believe our model does help in all of those cases, if that helps, Dr. Owens.
Who's on this end of the telemedicine? Who is on the patient?
On the patient end, or?
Yes. Who's on the patient end?
Okay, all right. Say you went in with neck pain or low back pain with referral down the leg to, say, Dr. Midias's clinic. They decided there was nothing surgical to do. Then we could evaluate you, make sure that your pain is controlled adequately with non-narcotic medications, and start physical therapy the same day. And if there are any lifestyle factors that need modification, whether it's smoking, dietary changes, emotional distress, abuse, depression, those can be started to be addressed with our health coaches and that are meeting with people frequently. Then we could establish, pardon me?
What's a health coach?
The health coach is a specialist in essentially empowering people to live better lives and to achieve goals that they're asking, that they're bringing up to us. So first,
RN, social work, psychology.
It's more of a role. Some may be RNs or NPs actually, and some may be in psychology, et cetera. But there are studies showing improved outcomes when health coaches are actually brought into the picture.
Is the health coach a licensed individual by any board?
Paul, I might have to defer that question to you.
They do not engage in any clinical services. They are support, emotional support services to help the patient, but it's a non-clinical service.
How can it be non-clinical when it involves a patient?
Well, respectfully, ma'am, the question is, it's not in connection with the treatment of the patient, but dealing with issues, emotional, to which that individual may have need. It is not in any respect trying to treat or diagnose that patient in any role.
So is that a
So are they clinical, are they licensed people or unlicensed?
Mary, correct me if I'm wrong, but some of these individuals may have licenses, but they do not use them.
Hi, Mary O'Connor. I'm the Chief Medical Officer at Voya Health. Thank you for your time. Our health coaches come from a variety of backgrounds. Primarily, they're nurses who are now doing health coaching. We have one licensed social worker who also does health coaching. And the purpose of the coaches is really to help individuals make healthy behavior change. And so part of the advantage to Dr. Matias and his practice with collaborating with us, forming a collaboration, is to be able to extend these type of support services to his patients. And so that, and the convenience of online physical therapy. The issue that Dr. Owen, that you've raised is, well, what is the need for a PA MD team in this loop when the patient has already been seen by an on-site provider? And that's a very legitimate question. The purpose of us bringing in the option of the patient also seeing Dr. Woznicka and Ms. Wagner is if they need further evaluation or there's a clinical change, or if our physical therapist needs some additional guidance regarding appropriate online physical therapy. So we're really serving as a way of enhancing the services that Dr. Matias and his on-site team can provide in the virtual space to make it more convenient for patients in Mississippi and to support their health journey and health goals.
I still don't understand the life coach bit.
I'd like to let y'all know, Dr. Medias has nurse practitioners and PAs already in his clinic. So, I mean, I'm not sure if that support role is needed from nurse practitioners and PAs, why it couldn't be filled with the ones that are already in his clinic.
Yeah, as opposed to unlicensed people who could potentially be practicing something even something construed to be a type of psychotherapy done by certified social workers, etc. And that to me, it's all medical care. You know, you're in a state where you have to have a license to wash hair. So would you like to make a motion to go to executive session discussion?
I would, Madam President. I move to close the meeting to consider whether to enter into executive session on this matter.
Dr. Owens? All in favor?
Aye.
Aye.
Okay. Close the meeting, pause the meeting to go to consider executive session.
Arlene, do we have to leave the room or can you?
Yeah, you need to leave the room.
We can use the back conference room by my office.
All right, I think we can hang up and I'll send an email.
I think they may be coming back. They're going to come back.
Okay. Is your phone 410-258-10?
No. I'll email you, Mary. Do you
Owens logged back in. Dr. Owens, have you logged in?
Yeah, I'm in.
All right. We're back in executive session. I'm going to let Dr. McClendon read the decision.
Thank you, Madam President. It was a unanimous vote to table the application for Randy Wagner, PA's application for a collaborative agreement.
Until the OLRC
Until-
can finalize our rules and regs.
Until the final OLRC regulations are approved.
Dr. Ray, may I ask when you anticipate that those regulations will be approved?
This is Ken Cleveland. I'm the executive director of the board. So the OLRC meetings are set up by the governor's office, and we don't have any control over when those are set up. We're usually just notified, 3 to 5 days in advance. So.
Okay, thank you.
Thank you. Do we have other matters before the executive committee?
No, ma'am.
Okay. Motion to adjourn.
So moved.
Dr. Owens,
Second.
all in favor?
All right.
Executive committee is adjourned. Thank y'all.
All right, thank you.